Welcome to the 36th episode of the Decentralized Opportunity Podcast. I'm your host, Tanner Lytle. And this week, Wyatt's out, but I'm joined by a special guest, Justus Decher from MyVitalz. Thank you for joining me on the podcast this week.
Hi, Tanner. How are you?
Doing great. I'm really excited to have you. We were chatting just a little bit before we hit the record button, and I think your story is going to be so neat for so many of our listeners because you have the wonderful history of working for a Silicon Valley based company. And then now you're here, running a company built out of Omaha, really supporting our local markets and really doing some neat stuff with that affects rural people too. So you kind of touch all of the buttons that we love to cover.
Good. Glad to be on. Thank you for the invitation.
Yeah, absolutely. So I guess let's just kind of kick off. You want to kind of give a high level overview of kind of who you are and what you do and a little bit of your history?
Oh, well, thanks. Tanner, this really started in Silicon Valley. Okay. So I'm just going to take it from there here. My wife and I went to Silicon Valley in the early 80s, spent about 25 years there, and now been back here about 20 years. But during that time, I had the privilege of meeting a lot of people, the big guys, have dinner with Steve Wozniak and have Steve Jobs be my neighbor next door in business community. And just watched a lot of things happen. It was kind of the impetus to that. Ended up in a company called Pacific Consultants. And I had, it was a think tank and design firm. And we had, we started out with 65 engineers. We grew it to 250 engineers. I remember to coin the phrase, I was drinking from the intellectual reservoir. When you just go down the hallway and you start talking to a guy and he had, 60 patents, and this was all different facets of it. We ended up being really, we were the guns for hire. And as Guns for Hire, we actually designed 65 stints for 35 major medical companies. And actually, at one point in my tenure at Pacific Consultants, I had to have a stint put in. And I actually did an open house where I showed everyone my stint being deployed. So that's how nerdy that was. And I kind of lost you there. I hope you're coming back on there, Tanner. There you are. Probably my biggest claim to fame there, though, was the Land Warrior. It was a new American digitalized fighting man. And we had gone up, our team had gone up against the Motorola's and Raytheons of the world, and we beat them, designing the Land Warrior from what they call COTS, computer off-the-shelf technology. Things that we bought at Fry's Electronics and hodgepodge together and designed this new American digitalized fighting man. He was a lethal weapon. Integrated weapon system with helmet-mounted displays, laser rangefinder, video camera, 2 Pentium computers that were immersible up to 15 meters. Just an incredible stuff that really took the American fighting man into the 21st century. That was an incredible effort. And in fact, while we were designing it, I had 157 units on pre-production when 9/11 hit. And overnight, the 10th Mountain Ranger Division and Department of Defense, they came in and they took all 157 units, and it went with the 10th Mountain Ranger Division to Afghanistan to fight the war. Gosh, that was an incredible story. A lot of media, the Wolf Blitzers and CNNs, the local TV stations, all the tech centers. And then in December 13th of 2001, it took us into a international conference at the Fairmont in San Jose, where we introduced the land warrior to the alphabets, the CIA, DIA, all these guys, international crowd, and we really got a big claim to fame. And as a result of that, I was able to take and put a scenario together that we were the first NASDAQ merger post 9/11. And that's kind of what launched it.
Yeah, no, there's so much to unpack already with what you were sharing. So let's go back a little bit
Sure.
to the Silicon Valley days, because that seems like an incredible amount of learning to happen being next door neighbors to the folks at Apple with Steve Jobs there and Steve Wozniak.
Right.
Is there any specific lessons that you've taken with you over the years from those guys in particular, or maybe just the community and the circle that happening during that era?
Let's see. First thing I would say is the community from there to here. I found that anyone at any time could walk across the street and go to work for a competitive type of company. And there were not issues with that. There weren't parameters or conditions upon workers. Now, of course, if you took technology across the street, that's a different thing. But in essence, you could work anywhere, anytime there. Couple mottos we had. One was our engineers work half days, but the half days were 12 hours. And we had a good time because we all lived for that dream. We ended up having one of the most powerful front end design engineering companies around. Like I said, we had different practices in there, won the military and defense contracts, and the medical was huge. We designed so many different things. Probably the one I really love the most is you've heard the company WL Gore, Gore-Tex, and those products. Well, one of their divisions was a medical division, and we designed what's called the Helix septal occluder. And it was designed because young girls between 9 and 12, some of them were born with congenital holes in their hearts. And we ended up at Medical Device Manufacturing Show in Minneapolis. We won the design contest because we designed a device that looked like a cocktail umbrella. And minimally invasively, they would insert it through the artery, go in, and the umbrella would turn inside out, and it would close the hole in their heart. Now, this went from needing a radical mastectomy for that young girl with 6 months or so recovering to a couple-week process. That's how we saw so many inventions being able to change the world, just about like what we're getting ready to go through right now. The technology ramp up is going to just be insurmountable with AI and stuff. But I remember at that time, what kept resonating in my mind was necessity is the mother of all invention. And that's what it is. And in fact, that segues actually into my company today, which was I came back here after working long hours in Silicon Valley, a misnomer that you go out to California and have a lot of fun. Oh, I had a lot of fun, but we worked a lot and designed a lot, just did some crazy great things out there. But when I came back here, because of my heritage, I really developed bad heart disease. And I remember in 2010, I actually I went in for some angina, and my cardiologist and friend and business partner told me, Justus, you're going to have a quadruple bypass. And I was like, whoa, and you want to talk about sobering? Um, I had it. I survived it. I came out on the other side, and I was like, wow, I had this reprieve. And then for the next 6 months, Tanner, I was scared to death. Anything that happened, whether it was angina or gas or costochondritis from them, opening my chest up, or panic attacks. I actually raced to the hospital 22 times in 6 months because I thought I was a goner. And I said, it's got to be a different way. And that was the impetus to designing MyVitalz, which was just an incredible story on its own, how it came about. And I want to do a little more takeoff here because you asked me about the community, and I started off with it, but I kind of got held up in my story. The one thing that I found out when I came back here, and I came here in 2004, was I didn't see that collaboration. I didn't see the impetus for keeping people here, very intelligent, off the planet smart engineers, like I have met all the predictive analytics people and stuff, is letting that intellectual reservoir, to go back and coin my phrase, still allow these people to leave this community. And in fact, I was asked by a few people, a few recognizable people that you would know, is what my thoughts were about, like the Scott Technology Center. That's the first place I went to work for. Gosh, it was the intellectual property transfers there. And it was about having that synergy because of the universities and the academic and the medical communities here. It was like, let's do something with that brain thrust that we have here. And it wasn't being done. I have to say, it's quite a 180-degree change now in 2022. I'm pretty happy with the retention of all the talent that is being utilized here.
Yeah, I definitely feel like there's a shift over the last few years here in Nebraska of really cultivating, embracing, and utilizing the talent that we have available, or doing our best to attract people to our communities. When the pandemic hit and that forced a lot of companies to go work remote, that really forced a lot of companies to actually start competing for workers, which was a huge thing that they didn't have to do before, because if they weren't paying well enough or treating well enough, their top workers went off to work remotely for companies off in Silicon Valley.
Right.
But I feel like a lot of the companies did actually embrace that call and make themselves extremely appealing and competitive in the market.
Mm-hmm.
And now the focus really is shifting to the next generation of entrepreneurs and trying to spark those things too. I want to circle back a little bit. You talked about, and while you were talking about the Silicon Valley days, I was drawing the same parallels as you were talking about this new opportunity that's coming with technology today, with the new
Yeah.
machine learning, AI based platforms.
Right.
We're going into a new era, really, just like you did in the 70s, 80s, and predominantly in
80s, yes.
that era, 80s. Yeah. Um, yeah, because 80s was what, Apple II era, going into the Macintosh, first versions of Windows. It was a whole new world for personal computing was really developed in that era. You talked about necessity being one of the big drivers for need, innovation, and opportunity.
Sure.
I'm seeing that so much today too, that you see kind of a gold rush mentality with AI. It seems like everyone wants to start their own AI company
Of
now just to
course.
strike it big.
Yeah.
But the real companies who succeed are the ones that find the true need in the market. Do you have any advice to people, or stories you could share, or things of trying to truly show that you have good product market fit, you have a product that shows good need? How do you go about determining that?
The best story I can come up with was Fry's Electronics in Silicon Valley. Now, are you familiar with the company?
Yep. Yep.
Okay, Fry's was it. If you had a product, you put it on the shelves. If it sold, you won big. But if it failed, you poof, you were gone. And that was it. The proof's in the pudding there. With technology, you you might be able to get away with some vaporware and blowing smoke in the beginning stages, but when it comes right down to it, the proof's in the pudding. It either works or it doesn't work. And we have we I think we came to a very sobering realization about technology. It either works or it doesn't work. Okay. And fortunately, and when you were talking there, I was envisioning back when I first started on the manufacturing side during the 80s. One of my best friends, his name was Dr. Jacques Benguiat. And Jacques came here as a multimillionaire now, but he came here with $50 in his pocket. And Jacques Jacques was an Englishman who was born in Egypt, but he kind of reminded you of a beetle, and he was just very eccentric. Okay, and as I've come to learn, the difference between crazy and eccentric is money. Uh, but Jacques designed most of the motherboards in the 80s. And he had won all the PC Editor's Choices awards. And we put companies like Northgate Computer Systems and Samsung. He built all the motherboard designs for those companies. And then we progressed on and went to the ASIC level, which is, for anyone who may not know what an ASIC is, it's ASIC, Application Specific Integrated Circuit. And at one time when we finished all that stuff, it was we had designed a Pentium, Pentium computer, not a 486, but the 586, in a single ASIC for most of the Korean companies. That was just amazing time and acceleration through the roof for technology. Okay. And full circle, I agree with you about machine language and the learning capabilities now. What I think the biggest chasm that we've actually crossed is understanding that this is all about data. And if you know that, then what do you do with it? Because that information is power. And that was um, one of those little phrases and idioms that you used to hear, is that information is power. Well, it's really powerful. Whether that's a million names or a million professions, a million um, data points, that's all very meaningful stuff. And that was the word that's become very powerful through the healthcare industry, is meaningful data. And that's where this is all leading to. Several years ago, and I think it was about 2006 and 2007, one of the very talented, off the planet smart data analysts, predictive guys, his name was Tad Wood. I don't know if you've heard Tad's name before, but I challenged Tad to design through Tableau, um, to design me a longitudinal health record. So everything you think, do, and say and touch, and all those social determinants of health, everything was captured in this longitudinal health record. It was amazing. It's actually still running today. Remind me, and I'll give you the the link to that, so you can see thousands of. I think there's 5,000 patients in a CMS, Centers for Medicaid and Medicare database, who I attributed. You remember when Obamacare came out?
Mm-hmm.
There was 4 disease states that they recognized. That was AMI, and acute myocardial infarction, CHF, COPD, and pneumonia. And those 4 diseases, if anyone over 65 went into a hospital, they were discharged, and if they were readmitted within 30 days, that was the 30-day readmission. If they were readmitted within those 30 days for any cause, CMS would not pay for that. And at the time, the admission rate was like $13,600. That's just to readmit the person. And then however many accumulated days that they stayed in the hospital, CMS would not pay for it. So it was incumbent upon everyone to get this straight. So, if you were discharged from having a heart attack and you went home and you got a urinary tract infection or a UTI, hey, the point was you didn't follow up with this patient. So it was challenging people to really start taking care of the patient. Didn't do a real good job of that, but we are now, because we moved those models into value-based care. So take you down another little rabbit hole.
Yeah, no, I love it. I guess we can start getting into your kind of story with MyVitalz as well.
Sure.
You were talking about before, and I was just taking notes. You kind of did the heart attack or your health issues really kind of spur the interest in seeding what was the company, or did you kind of
Yes.
have an idea before? That's what
No,
came in.
necessity is the mother of invention. Okay.
Mm-hmm.
So that and my emergency runs to the hospital 22 times in 6 months, that cost us all a lot of money just for those emergencies. And the point is to keep you out of the emergency room.
Mm-hmm.
We're able now, even today, to a pretty great degree, is to predict what's going on from trending and data that you're getting. That's why MyVitalz and remote patient monitoring is what happens between when you go to the doctor and you have to come back to the doctor in 6 months and he's told you to take this blood pressure medicine to control your hypertension and to exercise 30 minutes a day. And 6 months you go back and the doctor goes, how you doing? And you go, they're really not well, or sure, I'm exercising and no one's exercising. It's the big con is that now you can't get away with that, is that you start monitoring. Like you were showing me your app that you did 22,000 plus steps today. Okay.
Mm-hmm.
I mean, that's meaningful data there. So the important thing is, you asked me about different lessons learning through here. Okay. The biggest one, interoperability. Everybody can have their silos, but if you can't tie those silos together and speak the same language, it goes all the way back to when you may not even know these terms. I don't know. Beta and VHS.
Mm-hmm.
Okay. That was the first big one. It was like, no, they had to come up with a standard so that someone could go out and build a product that would play those. Okay. And so that's what we're looking for. Interoperability is the big thing. Being able to speak the same language across a number of different platforms. That's what it's all about. And if you can do that, you've mastered what we need, that communication protocol.
So MyVitalz, the mission of it, I guess, just to kind of explain to the audience, is you're a remote patient monitoring technology, correct? Can you kind of go into the solutions and kind of things that you do with the technology that you provide?
Sure. We provide devices. I build software. Okay. My company is a software company. It's a SaaS model. So that it's accessible anywhere, anytime, on any type of platform. Doesn't matter. You get to the internet, you can download it, you can look at our information. And that's where the security is a lot better than having an app that you would download. Mm-hmm. We take that information and then take the devices, whether that's a thermometer or blood pressure or scale or glucometer or a PTINR for anticoagulation, devices like that are cellular and Bluetooth. And then we allow the patient can take their readings and it goes up to the cloud, and then we provide that information back to the healthcare team and their families. That's the powerful thing here, is that you have oversight by the people that you want to oversee you. No longer are we comfortable, and COVID did this big time, is that no longer are we comfortable with the fact that we go off and we have our problems and issues and no one knows about it. So, like when my father and mother, when I moved away from them, it was like, well, is he taking his blood sugars? Is he taking his medicine? I had no idea. Now you can log in and look and see the last time Dad took his blood sugars, and if they were really high. And you can provide that information to the doctor. It's just like tomorrow I go to my cardiologist, and when I go in, I'll just pull up my screen. I'll say, here, check out my charts and stuff, And this is what I'm doing. I've stayed at a good weight. My A1C is, down there in the acceptable areas and sevens, a little high. But he has an opportunity to look at that data and say, you're not lying. There's all these data points across there, thousands of data points. In fact, it's really incredible because one of the demos that I show is I show my blood sugars since 2016 till now. And when I pull up the chart and it paints this picture, it's incredible. I see all the nurses and doctors look at this and go, wow, that was really powerful, Like, you cannot lie with technology. It's there. It either presents or not. So MyVitalz takes all that information and then provides it to the clinicians and the healthcare team and your family so that it's actionable data. What happens if my blood sugar goes really low? If somebody doesn't have the capability of seeing that, you can die from that. This actionable data allows the healthcare team and the family to take and go, okay, you're having some problems at this time of the day with your blood sugars. So let's adjust your insulin. That's the meaningful data part. And what I call that is patient-generated health data, because it actually says, hey guys, this is the real stuff. This is what happens between visits. And with this information, you can forecast what my outcomes are going to be on the other end. Very important. Very, very cool tool. And here's the greatest thing about this. This is ubiquitous. How many older people, 60, 70, 80 years old, have you seen on a smartphone? We're accustomed to it. It's a part of it. It's an appendage, okay? And being able to get those notifications and stuff that says, oh, God, I forgot. I should have taken my medicine. You have that opportunity now. We prompt those. We prompt that behavioral changes. And then the most important, Tanner, I got to tell you, this is the biggest one, is health disparities. We're not all created equal. I unfortunately, God, I hate to say that, but you know what? A lot of us don't have the capabilities. We don't have the insurance. We don't have the social determinants of health, the barriers like transportation, money, all those things to take and get to the doctor. These tools are meant especially for those, the most at risk, the people at home that could have a stroke because they're not being followed closely enough. You can take some simple tools like what we have that are inexpensive. I mean, we're talking about a hypertension, a blood pressure cuff, $60 to $75 one time, okay? And the cost of a SaaS model, whether that's $25 to $35 a month, to follow that one patient, to get that meaningful data out of there, to keep them from having to run to the emergency room, to have the ambulance come out. That's why we're doing this, okay? This spans that chasm very easily. It makes everyone on equal footing to be able to have their information be seen and to provide actionable measures for that, being able to make changes in their healthcare. Sorry, I get off on these.
No, I love it.
Tangents.
No, I absolutely love it. I'm curious, how are you guys going about data collection? Do you use wearables? Is it just data from doctors' visits? How do you go about collecting everything?
Okay, those again are Bluetooth or cellular devices. Now, we also have built in surveys that are into our system. So if you have an opportunity as a nurse and you're talking with the patient, you ask them those mental health and well-being questions. And we take those, like it could be a GAD-7, a DLA-20, or a PHQ-9 to determine if they're suicidal. You ask those questions. It could be a diabetic survey that says, hey, did you eat something before you took this blood sugar? Okay. All that information is also handled just like you handle a device reading. So you get a score to it, and then across the board, you start determining that you can make certain correlations. Excuse me. Is that Sally's mood was really poor today. And actually, if I look back through here, her blood sugars were all running low at the same time, and her mood was pretty bad. Those are direct correlations. Okay.
So are you using like a continuous glucose monitor or something to determine those things? Like your
Well,
blood sugar?
I actually am wearing a CG7, Dexcom CG7. And those are great, but anytime you take your blood sugar, it goes up and posts on the cloud. It's there, it's secure. It also then, you may take your blood pressure at the same time. That's the correlation between high blood sugars and high blood pressure, low blood sugar and mood. So there's a number of different factors, but the point being is that you can correlate this stuff. You can. There's so many data points that's where the machine language comes in. What do you do with this data? What is the trending? And you have to have a very reliable source to be able to take and, as we, over the period of years, we've written certain algorithms that tie into billing, because not all billing coders in hospitals and clinics are created equally. Okay. You throw all these CMS billing components at them, and these are new things. They may not know how these work. It's our obligation to take and help them through that minefield, be able to take, and if I'm going to give this device to a patient, I need to know how to bill for it effectively so that everybody gets a benefit from this. It gets paid for by the right services, so then they can take that data and actually do something with it.
One criticism I always hear about the healthcare system is it's always very reactive rather than proactive.
Yeah.
What is your game plan trying to make it, because your device is very proactive,
Right.
it's continuously monitoring. What challenges are you facing, and how are you trying to overcome that, that system?
I don't have much hair anymore, because that's a leading contributor to that. Actually, that's one of the very frustrating things. If you look at my company, I'm doing a lot of business nationally and not as much in Nebraska, because it was kind of sacrosanct. We do things this way, COVID kind of changed that. So we're on the upswing with this. Is that people understand now? I'll give you a perfect example of this. MyVitalz was awarded a Minority Health Initiative diabetes contract in January of 2020. It was actually awarded right in the end of February, beginning of March. Now, okay, so we were so excited. We had 11 counties in western Nebraska and 6 counties in northeastern Nebraska, and we're like, great, we're going to get to help all these minority and underprivileged and most at-risk patients with diabetes for public health departments and FQHCs, which is federally qualified health centers. COVID hit. It was like no one knew what to do. And it was like, it was kismet. It was like we were at the right place at the right time. That kind of uh, stimulated our tagline, which was we were built for this moment. And it was really true because community health workers couldn't go to these people's houses. And you had all these diabetic patients out there that weren't being monitored. So what did we do? We got a glucometer to them, and they could take their blood sugar, and it would post up to the cloud, and the healthcare team was sitting back there, didn't have to be exposed to COVID, and they could see their readings, and they could monitor their patients. But you know what? That wasn't, not all the people like that because, there were other people that's their business is that they sent community health workers out. Well, now we intervened in that process, but we needed to. It was appropriate and it was called for. So that single event of all the whatever happens in your life, if you fail forward. If you learn a lesson from it, that the second time you get up and you go back and do it again, you have this knowledge base now. This is what happened to us through COVID, is that we started learning about remote working, okay? We have healthcare worker shortages now that are going to be continually experienced for the next decade. Doctors, nurses, assistants, MAs, medical technicians, our devices and our, let me call it, rudimentary technology that's ubiquitous, taking your temperature, taking your blood pressure, stepping up on a scale, pricking your finger and taking your blood sugars. Those rudimentary devices are actually providing the impetus to transforming in our healthcare system to capturing all that data and doing something with it that's meaningful.
So what do you believe that machine learning AI will transform, enable for your product, but also just healthcare in general? We see so much, and we've talked about on this podcast, how it'll affect a lot of the business world, how it can affect your personal life, how you can kind of have a personal assistant now without actually having to hire somebody.
Right.
It's got to be revolutionary for healthcare. What are you seeing?
Oh my gosh, yes. Okay, could you imagine we have this, I always envisioned having this team around me of just really brilliant people. You say if you're the smartest person in the room, you're not doing your job, okay? So let's make it analogous as to having several really brilliant people through your life that you've met surrounding you. And you take all my information that I'm garnering from all these different patients, these thousands of patients across the country and thousands of data points, and I pull it in, and then I give it a set of conditions like, their social determinants of health. What's their status in the poverty line? Are they rural in rural America? Are they 80 years old? Do they have a broken leg? All those different things, all those different data sets that, we walk into the doctor every day and they probably have in some places like the VA. My primary care physician has between 5,000 and 10,000 patients. Okay. How can he remember all those people? He can't. Could he use an assistant? You want to talk about a Google assistant? It's analogous. So if that assistant was able to take all those data points and categorize them and put them in their silos, and then give you some feedback that you as a human can take and then go, now I'm going to add the human touch to this. Now that I've got all this information, right here in front of me, that I can get a summary shot of it, and I go, you know what? That's what I went to school for, is that this condition and that condition, and it's been going this long. If I did this, then that's really reaching the talents of the human mind. That it's that blend of technology and human interaction, um, that's what it's going to do. And
Yeah.
and I'm sorry, Tanner, but there's bad things that can happen with that too.
Mm-hmm.
So this is really, oh my God, I can't wait for this to happen. I can't wait for it to happen.
I was listening to a discussion talking about being the great equalizer. I think right now, GPT-4, they say, is around the equivalent of 120 IQ.
Right.
So it can score in the top 90% of
Sure.
the bar exams and things like that.
Right.
What they were saying is if everyone had a personal AI or an AI at their side, an assistant,
Right.
like you said, if you are an average person, so again, the bell curve, an average IQ is 100,
Right.
you immediately get a 20-point bump in
Yes.
being effective in terms of your life, your decision making, your how you deal in business, how you might do on a job interview, things like
Right.
that. And as AI gets smarter, so if it gets bumped to 130, 140, eventually 160, which is like Einstein level
Sure.
IQ,
Yes.
how quickly can we innovate as a species
Yes.
if everyone has that at their fingertips?
Absolutely. Exactly. And haven't you in your everyday life went out and saw people do some boneheaded things?
Yep.
Okay, you know, and then on the other end, the antithesis of that is see some people that just astounded you for their passion or their love or their intellectual capabilities. Okay, to a lesser point, are you this ubiquitous device here, and Google has given a lot of people a jump start on this. Who sang um, when the rain came falling down? Okay, and it'll tell you. It's that memory cue. I always love doing that, as especially when you're getting older and your memory gets a little. But the point being is that we're getting a taste of that right now, and now the big thing is the trusted sources. This
Mm-hmm.
conversation going on with Musk and of the world is really important because other, although we've not been a perfect society and nation, I think Pareto wise, we opt to do the best for other people and look out for them. Most charitable nation around. Um, so let's hope that we lead the way on this instead of leaving that to someone else that we're asking an AI derivative, and it's run by a rogue nation. You know, you could really do very wrong with this as well.
Yeah. Well, and it's just going to scale so quickly. You talked about meaningful data and how these large language models are trained right now is just on everything. So
Yes,
there's so much just noise and garbage and everything there.
absolutely.
As you get these libraries, these databases, these models built with actual meaningful, relevant, very potent data,
Sure.
then they're just going to continue to be exponentially more effective. And
Yes.
I think that's where your business is going to be really in a good position, because you're able to really get very specific data, lots of it,
Yes.
and utilize it very well.
Right. And you're absolutely right. Location. We were ahead of the curve. The impetus to this business started in 2010. 2013, we did proof of concept and everything. And in fact, I got to tell you, Tanner, I love this story. Downtown on the Old Market, in my office, my conference room, had 3 whiteboards the entire length of the walls, and I designed the whole system. And my daughter, who works, she works for the FBI, and I said, I designed this software, and she went, "No, Dad, you didn't design the software, did you?" And I said, "Yeah, I did." And she was like, "Oh, and could my dad design software?" I said, "I didn't write the code, but I laid this whole thing out the way it was supposed to work." First time proof of concept, it worked, Tanner. Those don't happen every day. This was meant to be. It put me right in there in the forefront of looking at the way we take care of other people. And, most of that stuff resonated from inside, from our experiences, okay? We rely on that intuitive state as to how people have had issues or how we resolve a problem. That's how we come up with this stuff. And that's why when we saw each other at the convention, I love what I do because of the capability. So no matter any of the hurdles or obstacles, whether man-made or monetary or whatever, even through all those issues since I've been back here in Nebraska, one by one, they're taken care of and they're overcome. And you just keep going forward. You fail forward, you go on to the next, you bring something in. There's multiple different manufacturers now that I can look at and test to see if the mean time between failure of devices meets the clinical state, the security of the product, main thing. You were asking me in the very beginning about my bio. Prior to this, I was the site manager for an 8A Alaskan Native corporation out at US Stratcom. And security was huge and paramount with all the people that working with all these engineers on, different tasks out at Stratcom for, whether it was naval warships or fighter jets or cybersecurity, any of those things. I learned that information about building security into the devices. So things like maybe you watch the series The Americans about the Russian couple who was able to tap into the vice president's heart monitor or his, I think it was an LVAD, a left ventricle assist device, and they were able to make it malfunction. Listen, there are some really precise things. So one of them is that security is built in. You're probably familiar with TLS, transport layer sockets, okay? Minimum is 1.2, okay, and we exceed that. Encryption, 256K encryption, which is embedded across whether it's at rest data. Those are the different those security points that need to be made. And then there's that interoperability that comes in and says, well, you know what? I can collect this data, but my health system is on Epic or McKesson or Cerner. How do I get my information into their system? And that's by a lot of money, is what they say, because you can't get those guys to move, you know? So what you do is we go back to that beta VHS, that standard. And whether it's Fire or HL7 or some variable from that, we get them to talk with each other and say that, you know, you use these fields and make them cross-train and be mapped so that you can send that information up there. It's not going to look as pretty as it looks on my, on my dashboard, but at least the information is up there and it's available to a lot of people across the platform.
Yeah, I was curious how you would get that interoperability, how you become the standard. I know Tesla right now is having the big war over who has electric vehicle chargers, and I think they're starting to win that battle as new manufacturers are starting to go that way.
Real quick, a little segue here in this story was that, I had, in the very beginning, I had an old IBM facility, a million square feet, and we were a contract manufacturer. I seen 500 people stop work because of an EEPROM that wasn't programmed correctly. You can shut a factory down for, an IC or software updates. It just happens. So that's why that supply chain is very important. And about AVLs and approved vendor lists. Those are all things that you just don't learn those things overnight. It's over a huge, period of time that gives you a good look at hardware, software, that interoperability between all those devices, and how you have to look ahead as to one thing that we're coming up to right now, just like your Tesla point, is that where are the raw materials and who controls them? What do you do? What do you do if a TSMC, which is Taiwan, that's a big chip manufacturer in Taiwan? What do you do if that falls in hands that are not compatible with us? So those are things that we need to be thinking about, and that's why millennials, everybody has to understand where they are in the framework of this, and to do what they're capable of doing to take and work it for the betterment of our society. If you want to put a good little twist and put the tie, the bow on the present, okay?
Yeah, and that goes back to, finding the necessity, right? If society needs it at this time or will need it in the future, if you're building the product like you were and then a pandemic hits, well, then you can then seize that opportunity because you're in the game to do so, right?
And then what do you do with that? You can be the greedy pharmaceutical manufacturing president who said, "Well, I've got this one med, and I can charge people 10,000 times percent of what it was, and make more money." Or you could do the right thing by making it affordable and putting it out for everyone. Like an insulin or something, making something affordable across the board.
Yeah. I guess to kind of wrap up here, there's one thing that I've noticed through just listening to you And just to kind of tie into something that I've been thinking about a long time is you have immense passion and drive for what you're doing right now. And it did take, I hope, again, I hope it just wasn't the health scare that got you so driven with it. I'm sure that there was a lot of interest before then.
Yeah.
And you built up a life of so many great skills to, execute on this.
Well, thank
Like
you.
you said, you had it all drawn out on a whiteboard, and it worked. So it was built into your head.
Yeah.
But I'm seeing so much as I think about my life, or as we think of others, whether they're wanting to enter careers or start their own business and do different things. One of the big differentiators that I'm seeing is passion, because it is how much you're going to be willing to invest in time and effort onto it.
Right.
And we touched on a little bit, with like the AI gold rush and different things where people are just constantly picking up something because it's the hot new thing.
Very good
Well,
dichotomy. Gold
yeah,
rush and AI.
yeah, but they'll never go as far as the ones who are really passionate about the problem that they're solving, right?
Yeah. Well, and let me. You prompted me to think of something here. There's about the passion. Is that here I was going forth to create this product, and right in the middle of it, and I had other competitors who were huge, like Medtronic's, huge competitor, and out of the blue, I received this FedEx package that was from a patent troll who had just designed up this generic 30,000 foot level look of what telehealth looks like, and said I was infringed upon their patent. And I stepped back and I looked at this and I went, I'm a fighter. Okay. All these other competitors and these big guys were paying these guys money for patent infringement. And so I went and talked to a couple of my friends. And then the next thing I know, I had a company out of San Francisco called Electronics Frontier Foundation. I fought these guys and I won. And I actually, over the period of time, I've actually been a part of Alice. If you'll look up Alice versus the patent infringement. I was a part of that lawsuit, and I was in an amicus brief that was presented to the Supreme Court. I mean, I just loved this, how it blossomed. I have some interviews out online that are specifically about this in patent trolls, and being able to fight back. You can have the best idea in the world, and somebody has got some more money, and they're able to buy somebody off, and they're way ahead of you, and they kind of crush you. You always have to be prepared to be able to do the metamorphosis in life. Passion is something you really cannot. I think you have it innately in you, and there's and it could be anybody across the board, an individual. But if you believe in something, that's where your passion resonates. It's innate. And for whatever that is, it could be over a person, place, or thing. I just believe that you not only should be able to follow that, but don't get demoralized if it doesn't happen like you think it's going to, or be able to take and change, because we are in an ever, especially coming within the next 5 years, we need to be able to fluently and fluidity make a change in our lives, to change our technology, or to be able to, round the curve. We have to be prepared to do those things. And that's what this technology is going to give us.
Well, very well said. Thank you again for joining us and
Yeah,
sharing all your great stories. I really hope we can continue to talk more, and maybe we can find another podcast and talk about in greater detail just overcoming that adversity, what you did through there, because I think that's a whole episode in itself.
sure. Well,
Yeah.
thank you for giving me the opportunity. Um, one thing that happens when you get later on in life is that this is all about journeyman apprentice. And I learned this through hospice and watching people who were dying want to be able to tell their story and pass this on, pass that knowledge base that they accumulated throughout all those years, no matter how innocuous it might be. But that was the point. And the apprentice can learn from the journeyman just as well as the journeyman can learn from the apprentice. Okay. And this is
Hmm.
very important. And just thank you for giving me the venue and the opportunity. Okay.
Absolutely. It's been my pleasure to have you, and like I said, I hope that people get a lot of value, and I'm sure they will. Real quick, if you want to kind of share where people can find you online, you and your company.
Sure. My company is MyVitalz. That's MY as in Yankee, V as in Victor, ITALZ as in zebra.com, myvitals.com. And there's a lot of information on us out there on the web. So, call us. Be more than happy to talk with you. And you can find me on LinkedIn as well, Justus Decher. Thanks. Thanks again, Tanner.
Yep, absolutely. And thank you to everybody who's listened this far. Please make sure to like, share. I think this one has some incredible information that lots of people find valuable.
Great.
But
Thanks
we
again.
will see you all next week. Bye.
All right. See you. Good night.